I just want to make people feel hopeful because there's so much hope here and there's so much positivity. And I just want to make somebody smile while they're getting their chemo and go on with that day and know that somebody cares about them.
This is the James Cancer-Free World podcast. I'm Steve Wartenberg, and today we're going to learn all about the incredible team of hundreds of volunteers here at the James Cancer Hospital. We have two guests, Kathleen Kiene and Laura Schoettmer. Katie is the Administrative Associate Director of the James System-Wide Volunteer Services. In the first half of the episode, Katie will tell us all about her volunteers who are an integral part of what makes the James one of the best and most patient-friendly cancer hospitals anywhere. Katie will fill us in on the wide range of services and departments these volunteers are involved in and how you can contact her and become a volunteer. In the second half, Laura will join us. Laura is a longtime volunteer at the hospital, and she was also a patient at the James. Welcome to the podcast.
Thank you.
So I've had a chance over the years to talk to some of the volunteers, and they're amazing.
They are. We are so fortunate to have individuals come to us and want to share their time to support patients and families and help our hospital be a more comfortable and kind of welcoming place to receive care.
And they certainly do that. And just a little background on you. I know you started in patient experience before you moved over and headed up volunteers. So what exactly is patient experience and what brought you over to leading your army of volunteers?
So patient experience is comprised of a couple of different parts, one being the volunteer program, patient advocacy, our public space areas, and our housing program. And so years ago, we had two separate departments, guest services and volunteer services. And when those combined, I joined that team. And then as I was working with that team as a patient advocate, I began meeting the volunteers and seeing the work that they were doing, and there was an opening to lead that aspect of our team, which I was so fortunate to take.
What year was that?
I started in patient experience in 2010, and then in 2013 started kind of leading the volunteer aspect.
And I should remember this, but what year did the new James open?
2014.
So, okay,
yes.
So you had to ramp up for the giant new, beautiful hospital, and I'm guessing increase the number of volunteers.
We did. We added about 100 volunteers at that point, and then it was amazing that many of those new volunteers helped support the patient move. So over the course of a Saturday and Sunday, when the patients moved into the new James, volunteers played a part in wayfinding and escorting and kind of supporting the move effort.
Wow, I hadn't thought of that when you open a new hospital, all the patients in the old one, some of them connected to IVs and in the midst of treatment and not, feeling so well. What was that like to move, I don't even know, 100 or so patients?
Yeah, our volunteers almost created like a human chain along the move route, just to be smiling and welcoming and kind of creating the path as the beds were transported, and then help to escort families. So once the patient was settled in their new room, a volunteer would escort the family members over to join their loved one. So it was an all hands on deck effort, and I think just really enhanced by kind of that care and support and attention that the volunteers could provide.
That must have been a pretty rewarding experience for you and your volunteers.
It was. I think it still stands in our minds as just a moment where we were able to make such an impact on such a momentous event.
Yeah, I'm trying to picture that, and it just seems like amazing, that chain of volunteers moving people, smiling and talking to them and making them feel comfortable in a little bit of an anxious situation. So, and now here it is, 10 years later. How many volunteers do you have? Now, I know you're in charge of volunteers at the James and also the Wexner medical center hospitals, but at the James, about how many volunteers do you have?
Yeah, we have about 300 volunteers that support the James Cancer Hospital, our tall tower here on campus. And then we also have volunteers stationed at Martha Morehouse, at the Stephanie Spielman Comprehensive Breast Center, as well as the new James Outpatient Care Facility on Kenny Road.
Now, as we mentioned, Laura is a former patient who was a volunteer, although I think in her case she was a volunteer first. But where do you find your volunteers? I do know that there are a lot of patients who want to give back to the place that treated them and in a really difficult situation. So are a lot of patients, their family members, people who've never had cancer? Where do you find people?
Yeah, so we are fortunate that many people do come to us, and many of them have had care. So they were a patient themselves. Many times it is family members or friends who maybe supported a patient while they had care here that later then come back to volunteer. But also we just have individuals from the community that know of the James work in the greater community and see that in action, and then seek to come here and share more time supporting our efforts. And then we also have many students from Ohio State that are part of our program as well.
I forgot about that element. Yeah, that they can do community outreach work, and this is what a great way to do it. And as you were saying that, a couple thoughts occurred to me that the family members of patients either already were or became really good caregivers when they help their family members, and they might want to continue doing that. So maybe that's an element of why they volunteered, that they're good at and enjoy and understand the importance of caregiving.
Yeah, I think it's that opportunity to give back. I think it's that opportunity to be that extra layer of support. And so through all of these kind of tender actions that they're doing while volunteering, they know that it's not only benefiting these current patients, but continuing to benefit our patients ongoing through their efforts.
Yeah, and another thing I thought of is Pelotonia is now where we've been doing it 16 years, and that's connected a lot of people with the James. Do you get people who rode in Pelotonia who say, I want to do more, maybe I'll volunteer?
Yeah, and I think it's been amazing through Pelotonia too, that not only can you do the biking, but they also have the other challenger aspect. And so we have many people that want to make items. And so I'm going to knit 100 hats for patients as part of my project. And then others that have ridden and want to be a volunteer that's coming on a weekly basis. And so it certainly has been a wonderful conduit of us to learn of people's interests and get them connected with something that they're doing on a weekly basis.
Yeah, I think that once you can connect someone with the James, they're going to want to get involved.
Yeah.
So
the energy is infectious.
So I'm guessing a huge part of your job is organization and scheduling and matching up people in the different departments that you think that they'll do well in and enjoy. So what are some of the different areas within the James and the Spielman and on West Campus that your volunteers do?
So we have a lot of volunteer support dedicated to wayfinding and escorting. We are a big place, but we want it to feel friendly. And so volunteers are often the first face that individuals see as they step into our buildings. And then they can identify very quickly where someone needs to go or what their question or need is, and then they can either fulfill that or connect them, to the right staff member, to support if it's a question versus needing to get from point A to point B.
Yeah, I've talked to people about that. Someone could be coming from Kentucky or Maryland and is pretty anxious and nervous, and walking in that door and having a friendly face saying, "Hey, how can I help you?" I mean, that is huge.
Yeah, I think it makes our space so much less intimidating, and they feel that inviting nature of it, and you can see sometimes just some of the stress melt off their shoulders just a little bit, and then we can start to carry on with where they need to go and what's going to happen over the course of their care that particular day.
Okay, so wayfinders.
We have a lot of volunteers that are in some of our treatment areas. So chemotherapy is one of those departments. Chemo treatments can sometimes range for several hours, and so so volunteers are in the space and they are visiting patients. They're just connecting with them, talking with them, and providing companionship. They also help to get refreshments, warm blankets, things that might make a patient a little more comfortable, while the treatment is taking place. And so I think that support helps make a long treatment a little bit easier. And since our volunteers are scheduled weekly, they often see a patient from week to week over the course of their treatment.
If they're on Tuesdays and the patient's every Tuesday.
Exactly.
And from what I understand and have seen a little bit, it's not like you're in a private room getting chemo. You're in a bigger room, right, with other people. So, I'm guessing to create a little more of a friendly atmosphere.
Yeah, our chemo departments, each of them are set up, have similarities as they're set up, but some have more of a kind of a open style to them, and so there is kind of a community in when you're there for treatment, you get to know sometimes other patients and also the volunteers as you see them from week to week, and I think that consistency also helps a patient feel comfortable because they know who they're going to see each week when they're coming.
Okay, what's another area?
Another area where our volunteers are helping is in the emergency department. Also a very stressful place, and many times our cancer patients are coming rather urgently to the emergency department, and so volunteers are in that space, to help make sure that family get back to their loved ones once they're in one of the rooms receiving care. And we also have kind of a separate area of the emergency department for oncology patients. And so volunteers will circulate and check on them as they're being assessed and it's being decided if they're going to be admitted to the hospital.
Become a little bit high tech in surgery where there aren't boards that sort of update you.
Yes.
And so you've gone a long way in helping people know where their loved one, what stage they're in and when they can be expected, and then the volunteers help even add even more to that.
Yes, and also text messages. Whereas we would call an individual up to the desk to give them an update. Yeah. Now they can receive text, but even still, the volunteers support the surgery waiting area. And often, when the family is ready to speak to the doctor, they help to take the family to a private space for that conversation and help kind of just keep them calm and comfortable until the physician, it comes to the room to share, an update from the procedure that took place. And so they help to be kind of that extra resource and that extra supportive thing. And I think that's really special for our families because often they are expending energy thinking about the patient and doing everything, to support that. They're often surprised that volunteers are offering to support them. And I think that's a really beautiful piece here, that we're able to take care of them in that moment through the volunteers' efforts.
I think it does help a lot, yeah. Okay, surgery. What's next?
We also have volunteers that are here in the evenings. It's a program we call Restful Nights. And so from 5:15 to 7:15 p.m., we have two carts that are manned by volunteers, and they go and visit our hospitalized patients in the James, and they just go to the room and just offer small comfort and amenity items that might help them rest or relax. And so simple things, crossword puzzles, magazines, books, chapstick, sleep masks, things that are small in nature but often start a much longer conversation and turn into just a really kind of bonding kind of moment between the volunteer and the patient, and just another way for us to kind of show our patients that we're thinking about them, we're taking notice of what might make their night a little bit easier.
Yeah, as you were saying that, I'm thinking the conversation part of it is probably huge.
Yeah,
just have someone to talk to when you're alone in the room with the cancer diagnosis and treatment.
Yeah, often maybe family have not returned yet. If they're coming to stay overnight, the clinical teams are not quite as busy going in and out of the room at that time, and so it's an opportunity just to talk with the patient, doesn't have anything to do with medicine. Often people are talking about books they're reading, shows they're watching, their occupation, their hobbies, and volunteers have spent many minutes just doing kind of daily activities with patients. One patient wanted to watch Jeopardy with somebody else because that was normal for their routine on an evening. One patient had his guitar there and shared some of the music that he had wrote, and the volunteers got to hear him play. And so just really kind of just situations where people just were kind of being together and just enjoying each other's company. And I think it often has nothing to do with the items that we're sharing, but has everything to do with just that companionship and bond that happens.
Yeah, cancer patients are pretty resilient and amazing.
Yes. Yes, I think that's what continues to inspire our team, just because as they talk with patients and hear about, hear their attitude, hear how they approach things, it continues to remind us that, through these small actions of kindness, we can continue to, contribute to their healing and hopefully help them along the way.
I like that. Small acts of kindness. You do, your team does hundreds a day.
Yeah.
Any other areas?
And we are also, as we are in, we have many of our ambulatory facilities, and so in those areas.
Wait, what does ambulatory mean?
So those are kind of our outpatient buildings, where patients coming for same day appointment. As we continue to expand, that's one big area where we expanded was to the James Outpatient Care building on West Campus, and so up there volunteers are in our hematology oncology department, and so they're in the space. They're helping to check on patients and provide them with snacks as they're there as they're there for their appointment. They're helping to stock supplies. They help to wipe down rooms in the waiting areas so that everything kind of flows smoothly and is a comfortable experience.
Yeah, I hadn't thought about that. The James has opened a couple new facilities, and that means you need to find teams of volunteers to be there.
Yes.
So new challenges for you and your team.
Yes. Exciting challenges.
That was a great overview, and I think volunteering at the James can be a rewarding, amazing experience. So if anyone listening wants to contact you and wants to start the process and become a volunteer, what do they do?
If anybody's interested, please go to our website, our main James Cancer Hospital website, and you'll see a tab that talks about volunteers. So you can click on that tab. You can see how to apply and see additional details, about our program and what all volunteers are doing.
And I'm guessing if anyone's nervous and says, well, I'm not trained or I'd never done this before, you will train and help them, right?
Yes, absolutely. All we need is your energy, and we'll take it from there. We'll train you on the tasks that you're doing. And then, of course, you have a training all about the hospital and how to interact here with patients and visitors, being since the hospital is a little more unique volunteer environment. But we'll take care of all of that.
Okay, great. We're going to take a quick break, and when we come back, Laura will join us and fill us in on her experiences as a patient and a volunteer.
The best outcomes for treating cancer come from early detection and early diagnosis.
The James Cancer Diagnostic Center at Ohio State
is designed to provide rapid evaluation and a clear diagnosis.
We are transforming care by giving patients direct access
to cancer experts who study and treat cancer every day.
If you think you have cancer, the choice is clear.
Choose the James Cancer Diagnostic Center.
We're back with Katie, and Laura is joining us, so welcome.
Thank you, Steve.
So you have a great story to tell, and you started volunteering before your diagnosis for cancer.
I did.
So tell us a little about your life then when you first volunteered and what made you decide to become a James volunteer.
Well, I started volunteering in 2015, and it was because shortly before that I had lost my cousin to breast cancer.
Oh, sorry.
And thank you. And I was very angry and very sad. There wasn't anything I could do about it because my husband and I had donated to several cancer foundations, and like you, he has been riding in Pelotonia since its inception and raised a lot of money there. But I just felt like I needed to avenge my cousin's death. And a friend of mine was volunteering here, and she suggested maybe this would be something that I would enjoy. So I contacted Katie, and I told her the same story. And I remember getting teary in your office. You asked me why I wanted to volunteer, and I started crying. And I said I wanted to work with patients. And so I started on 5 James in the infusion floor.
5 James, 5th floor.
5th floor.
Infusion.
Yes, 5th
Okay.
floor, where patients get chemo. And a lot of my friends thought I was crazy. Why would you want to be working with bald, sick cancer patients? Because that's what most people think
Because
when you
they
get
thought
chemo.
it would be depressing.
Exactly.
And I have a feeling you're going to say
It is
yeah.
not depressing. It is
Yeah.
so fulfilling and so rewarding. And every Thursday morning when I walk into the James lobby and just see how airy and spacious it is, and usually there's some live music going on, and right now the Christmas tree is fabulous, but it's just such a hopeful place. And I don't feel depressed. I feel exhilarated after my shift of volunteering, because I know that what I say to my husband when I'm leaving in the morning is, okay, see you later. I'm going to go make some cancer patients smile now.
Yeah.
And that's what it's about.
Now, Katie, do you hear that from others, that they might perhaps, before they start volunteering, they're a little worried about that this could be difficult emotionally for me, and then you hear the same story that Laura just told?
Yeah, a lot of times people will say, well, do patients really want to talk, or will they accept, help or support if I offer it to them, because they have a lot on their minds as they're, getting care. And we often find that, patients are talkative, they're interactive, they appreciate kind of finding those commonalities and having a non-medical conversation. And in the end, volunteers often find that they walk away with such an imprint from the conversation that they had with the patient, and they also leave an imprint too through that kind of bonding that they do, through those conversations.
Yeah, so Laura, you started here as a volunteer in 2015.
I did.
And then at what point, or what made you, or any symptoms or the way you were feeling that led you to whatever doctor who eventually diagnosed you with lymphoma?
Yeah, I had a little spot in my jaw, and I will skip all the details, but it did come to a diagnosis of non-Hodgkin's lymphoma, diffuse large B cell, and Dr. Rob Baiocchi was my oncologist, and he and his team did a great job. But I was a volunteer for 3 years before I was diagnosed, and then after being diagnosed, I had a completely different appreciation for the patients and what they were going through.
Now, before we get into that, I'm curious, if you were a volunteer here for 3 years, so you met some doctors, you met a lot of patients. Did that in any way give you a little confidence that, hey, I'm at a really, really good hospital, I'm at the right place, and that reduced a little anxiety?
100%. I knew this is exactly where I was going to be coming for treatment. But even knowing what to expect after watching so many patients go through it, it's still very overwhelming, even knowing what to expect. But definitely, I knew there was no question that I was going to get my treatment.
I'm not saying you don't have any anxiety.
Oh,
and stress,
no, right.
But at least you knew a little bit about cancer and treatment and about the quality of the staff. And Rob Baiocchi he's like world known in terms of blood cancers.
Amazing.
And he's
amazing.
Created some big breakthroughs.
Yes, he has.
So, I mean, did you know that?
I did not know that.
Yeah.
At the time, I did not know that. I know that now. And I'm so happy that I was lucky enough to be under his care.
So I'm guessing that some of the other volunteers you'd become friends with, and how does that work? How do they help you? And even when you were receiving treatment and a volunteer came to talk to you?
Yeah, well, and it's funny because, of course, I was a little judgy about my volunteers, but because I knew what I would do when walking into a patient's room. But the volunteers are great, and Katie is great and has made it feel like a family setting. And although I don't know a lot of the volunteers because we're on different shifts, I became very good friends with the two women who volunteered on the shift after mine. and we would get together and lunch frequently, and it was just a very a friendly environment. And I think the volunteers have compassion, so they're by nature, I would say, nice people. They should be anyway. And we all, the ones that I did get to meet and the ones that Katie introduced me to were, they're wonderful. They're all wonderful people.
Yeah, Katie, just by the nature of cancer and how prevalent it is, I'm sure Laura's not by any means the first volunteer you've had who's been diagnosed. How often does that happen, and how do you take care of your team members when that happens?
Yeah, there often are times where we learn of a volunteer's health challenges or maybe a new diagnosis or reoccurrence, and I think it's when we rally around each other, and sometimes it looks small on the surface, but it just might be sending an email that I'm thinking about you today. Are you doing okay? And sometimes it's meeting them at an appointment, just squeeze their hand really quick before they go in, for that aspect of care. And so I think it's amazing that we have become this family, and it's not just health related stuff, but it's celebratory things like people riding in Pelotonia, or students getting into medical school, or a new grandchild is born, and we get to witness all these life events together, and I think it's pretty special because we have become kind of this family.
Mm-hmm.
Laura, you were diagnosed in 2018?
Correct.
So walk us through your treatment, and knock on wood, how you're doing now and are, I think, cancer-free.
I am cancer-free. I am 6 years cancer-free. And as I mentioned, I knew what to expect because I had seen other patients go through it.
Who had the same cancer.
Who had the same cancer. But actually sitting in the chair going through it myself was definitely scary. And that's one of the things as a volunteer now, I want to make sure patients don't feel scared when they're sitting in the chair for the first time.
Getting their chemo.
Which
is what you were the volunteer
I'm sorry.
for.
Yes, I do.
So wow, it's not. It's ironic in a good way that you got to.
It is.
So
it is, and so I went through 6 rounds of chemo. It took about 6 months of treatment. I did lose all my hair, and I continued to volunteer while I was going through treatment.
Really?
If I felt well enough, and I usually did. And
why? Why was that important for you to do that?
To give hope to other patients who were going through the same thing.
And you would talk to them about, like, we're both going through this right now.
Yes, we are.
Wow.
And we're going to compare how quickly our hair grows back at the end. And I just thought it was important for the patients to see someone who had gone through it or was going through it and made it through it. And it was it gave me a different perspective from the patient's chair instead of just being the volunteer walking in. And I understand the anxiety. There's physical and mental stress, and the anxiety sometimes can be off the charts because you don't know if this poison that you're putting into your veins is actually working. And so I understand that with the patients now.
The anxiety is you don't know the outcome.
Yes.
And wow, so what's that like when you're done treatment, it's successful, and the clock keeps ticking and you're 5-6 years cancer-free?
It is a really good feeling because once, in the type that I had, once you make it 5 years, it's a pretty good sign that you're going to be good for the rest of your life.
The odds are good.
The odds are in your favor. Yes.
Wow.
And I hope that everybody gets to where I am, and most people here at the James do get to where I am.
And it's kind of amazing that, I don't know, I'm just going to say 20 years ago, 30 years ago, someone diagnosed with what you had, the outcome would not have been good, but research and clinical trials, and look at you, you're doing great, and that's amazing.
It is, thank you.
So now that you're through to the other end, although it's never over. People have talked about how when you get your yearly scans, you're always nervous. But how has it changed you, and how has it, I think you talked about this a little, how's it made you a better person and volunteer?
I definitely appreciate life more now, and I definitely appreciate what the patients are going through now. And if it's a first-time patient that I haven't seen before, because as Katie mentioned prior, I volunteer every Thursday, so I do see a lot of the same patients. So if I walk into a room and I see a new patient that I haven't seen before, I introduce myself and I tell them, I'm sorry that you're here. I'm happy that you're here because this is the best place to be for why you're here. And as long as you're here on my shift, I'm going to make sure that you're calm and you're comfortable and you're not afraid. And that's, I think, the biggest thing. Patients are afraid. They don't know what to expect. They don't know how they're going to feel after this chemo. And a lot of patients don't want to bother a nurse if they're cold. They don't want to say, excuse me, can I get a blanket? But I offer them a blanket because when that juice gets flowing, you get cold in chemo. So I want to make sure that they're physically comfortable and mentally comfortable and just feel safe.
I hadn't thought about the actual liquid chemo that goes through you is cold. And when it's cold, liquid goes through your body, you're going to get cold.
It makes you feel cold.
Your immune system's a little compromised anyway, so you're going to be cold. So you proactively keep people warm.
Yes, yes, physically and hopefully mentally with just some conversation and, like she mentioned earlier, the bonding that goes on with the patients that I see weekly, I become friends with. Because, you know, it truly stinks that you have to come here every week. But while I'm here, I'm going to tell you a joke or make you laugh or just make you comfortable and make sure that you're okay when you're here.
Before we wrap up, I have one final question for each of you. But Katie, once again, can tell people if they're interested in volunteering how to find you.
Absolutely. You can check us out on the James Cancer Hospital website. There's a tab dedicated to volunteering, so you'll see all of our information there. Please reach out to us. We're happy to talk with you further and get you involved.
Okay, so I always like to end this by asking people why you do what you do. And Katie, I'll start with you. You've devoted your entire professional career to patient experience and now volunteer services to helping people. And there's lots of ways to help people. You don't have to be a doctor or a scientist. And you're helping. Why is it that you've devoted your whole career to helping people?
I think there's nothing more powerful than the power of people, and that's what the James is. We are one big puzzle of all smaller pieces, and everything that each of us do makes such a big impact. And it's something that just wells me up, just with hope and, being able to dedicate to something bigger than myself.
Yeah, I totally agree. And Laura, you definitely, you had your own career and life, and now between cancer and volunteering, why are you so committed to every Thursday being there in that room helping people?
I just want to make people feel hopeful because there's so much hope here and there's so much positivity. And I just want to make somebody smile while they're getting their chemo and go on with that day and know that somebody cares about them and that there is hope.
So Katie sort of explained that when you leave at the end of your shift, what's your mood?
So happy, so fulfilled, and so I feel like I've made a difference on Thursdays in the world.
Well, thank you both very much for sharing your stories. And Laura, knock on wood that you're going to be 30, 40, 50 more years cancer-free and volunteering here at the James.
Oh, I will be.
All right.
Thank you
both. This podcast is brought to you by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. For more information, check out our website, cancer.osu.edu.